Hello and welcome to tonight's episode of Vets Clinic TV with myself, Adrian Cornter, and
myself, Edward Gilland.
As you can see, that Joe unfortunately is not with us today. He's off sunning himself in the south of France, skiing. Do you sun yourself if you're skiing?
He did too much work at Crufts or something along those lines, and now he needs a break.
Yeah, so it's a completely new lineup this week, so I'll try and keep it together in his absence, but apologies in advance. But we actually have a very good show for this week. I know he says we have a good show every week, but this week's a particularly good show. Because of course we'll be doing our usual rundown of the news stories, and Ed and I will be answering your questions later on in the show, your veterinary questions. But this week we're joined by a very special guest. We're joined by Filippo, who's a specialist in dermatology from the referral centre here in Swindon, and we're going to be having a chat about skin disease. Now, skin disease is really common in pets.
Absolutely.
I think it's probably the most common reason, other than routine vaccinations, wormers, etc., that people would present to the clinic.
And even one of the animals that I've had in today for a vaccine, the owner happened to mention that the dog's always chewing its feet, and although it came in for a vaccine, it ended up being more about the skin disease than anything else. Yeah,
very, very common. So I should imagine a lot of you out there have pets that are affected or will be affected by this. So keep tuned, and hopefully you'll learn something that will be of great use to you. Maybe save you some vet bills or some problems in the future.
Right, and help to keep the animals comfy, which is
absolutely.
That's most important thing.
And actually, we'll be joined today by a client of ours who has a long-standing skin problem. She just moved to us, and I'm going to be chatting to her and to Filippo about management of general long-term skin disease. So should be very interesting. So. Ed, would you like to discuss this week's competition?
Okay, as usual, we've got a competition today. The best caption of the photo that Archie's going to be putting up in a minute, the best caption for this photo gets to win and the photo's now on the screen in front of you. That photo's on our Facebook page. It shows a couple of the dogs that belong to Heather, one of the ladies that works on the food side of the business. The dogs are there playing together, and the best caption for that wins a bag of our food. So. Get thinking, come up with a nice entertaining comment about that photo, and we'll pick your best one and they'll win some food. Yeah,
I'll try and do as Joe does and read out some as we go along, but I'm not quite as womanly as Joe and not as good as multitasking. So it might be that when Ed comes back later on in the show, he's had a look through and picked some of the best one out for us. That might work best. So let's talk about the news stories. I think we've got 3 this week. The first one is this. I don't know if anybody out there saw this documentary recently on legally bringing puppies into the country, and I think mainly the crux of it was that basically their rabies vaccination status wasn't up to date at the time they come in. So in order to get rabies vaccination, you have to be how old before you have the vaccination?
You ought to be at least a couple of months old, and then shouldn't be travelling immediately.
16 weeks probably. 16 weeks, and then you've got to wait after the vaccination till you can come in. And these people weren't. They were basically vaccinating puppies. Puppies can't respond to vaccinations because of something called maternally derived antibodies, which, Ed, you want to discuss?
Yeah, basically in the milk, the puppies get the colostrum and they get some antibodies. That's one of the reasons why we give a couple of vaccines to young puppies, is to make sure that the ones that had a weaker maternally derived immunity, we're catching them early enough to give them immunity, but equally the ones that have stronger immunity, we're catching them late enough that they get a good immunity to the vaccine. And I think we all know, and we can all just imagine that if you've got a very young puppy coming away from its mother, leaving its little mates, leaving the environment it's been used to, travelling, going through the stress of the rehoming, that's a lot of stress to be putting a young animal through, even when it's just moving a few miles from the breeder down the road to your house. If these animals are moving an awfully long distance, it's putting them through a lot more stress, and a lot of the stories suggest that a lot of these animals are really far too young. They shouldn't even be leaving their mothers at that stage, let alone being put through. And there's some pictures apparently of some of the quite dreadful conditions that some of these dogs have been found in coming into the country. Unfortunately, I think it's typical of the society we live in. If we can buy meat cheaply from abroad or puppies cheaply from abroad, there's.
What would you say would be the biggest risk here of what's happening of not vaccinating them at the right age?
There's got to be a risk that potentially you could get an animal coming in with rabies, which not only is a risk to that dog, but with the legislation as it is, any animal in the UK that's been in contact with an animal with rabies would get destroyed. So if you've got 2 or 3 dogs and you buy in a puppy that brings rabies in, potentially you're looking at a nightmare situation where you could...
Not just your dogs either.
It could be the other dogs that have been at the vets the day you bought it in. Your cat? Oh, you could get rabies.
Yeah, I suppose more to the point, you and your children in your family could get rabies if you got bitten.
I'd be much more concerned about my dogs than I'd be concerned about me or my wife.
Yeah, so and the incubation period of rabies, so basically the incubation period is the length of time from when you get exposed to the virus, which rabies is, or bacteria, till you show signs, and it can be quite a long time. So, you know, they could be incubating this disease, you bring them over thinking, oh, what a cute puppy, and then your kid ends up getting rabies. And I think to date there's still only been one, possibly a few more now, case of rabies that people have survived once they've gone on to develop clinical signs.
Yeah, once you've got clinical signs,
it's game over.
You've pretty much had it. You need to be immune before you get the clinical signs. Rabies is a really cool virus, and hopefully, for your sake, Adrian's going to interrupt me at this stage. But
he's like talking about how rabies works. I think anything that changes your behaviour, and that can be parasites, viruses, etc., is essentially a very interesting disease, but it's a nasty one too.
Oh, definitely, absolutely horrible for the animals and the humans exposed to it, and not something that we need to be taking any risks about in this country at all. So really, really sad to see that some people are ignoring that risk in favour of making a few extra quid.
Yeah, terrible. Well, let's move on. I'm sure we could talk about that for a while, actually, because of all the changes in legislation, etc., that have led to that, really. But let's move on to the next one, which isn't quite so drastic. I mean, there's a pig who thinks he's a dog. Yeah, and again, I think we've got some pictures for you to show. It's a pig. I don't have the pig's name to hand. Gilbert, there we go.
It's a pig called Gilbert.
Who grew up with a pair of Yorkshire Terriers and now acts exactly like he is a dog. Rolls over, play fetch, etc. And obviously, growing up with the dogs probably did help with that. But I think that pigs in general can make quite good pets. I mean, I've seen a pig on a lead when I was in Spain recently, and I think that they probably would roll over and fetch, etc., quite normally.
They're very, very intelligent animals, very easy to teach them tricks and things, but then the same is true for an awful lot of things. I don't think we've seen any pigs brought in as pets by our clients here yet. But we've certainly got plenty of people that have pet chickens and things like that, and have just as strong a relationship with their animals as I have with mine.
I mean, there's a bit of a trend going on, kind of a bit of a craze in there for what we call the micro pig, which isn't really.
Yes, this pig's described as a micro pig. I'm sure the Yorkies in its life wouldn't.
Yeah, I think people think they're going to be like this big when they're fully grown, but they're really not. I mean, they're massive. They're the size of a great big fat Labrador or something.
I don't know whether you've been able to see on the screen the photo of the pig's head sticking out of the cat flap. But have we got that photo, Archie? Yeah, and that's a really cute photo. But clearly, this is not a tiny little animal. This is quite a large porker, but looks really friendly and looks really happy.
The last story that we have for you this week, and I suppose probably the biggest story of all in the week recently for doggy people, would be that it's been Crufts this week. Fantastically big dog show, and Vets Clinic were there this week. We had a great show. A lot of Vets Kitchen food was sold, and we've got a little VT to bring you now of Joe, in case you were missing him, at Crufts, giving a little talk about what we were up to there. And in that break, I'm going to say goodbye to Ed, who's going to come back later and answer your questions and hopefully help judge that competition. And we're going to bring in Filippo from the specialist service, and we're going to have a little chat about skin disease. We'll see you soon.
Well, just come up a bit higher here at Crufts, just to give you an idea of the scale of this show, because it's absolutely enormous. Apparently 160,000 people come here every year, which you can well believe when you're here, because it is so packed. It takes you forever to get anywhere, and there's obviously a few dogs here as well, not to mention those. I think it's about 28,000 dogs are exhibited here. And everyone who's anyone here in the dog world is here, all the pet food manufacturers, people who sell bedding and accessories, and everyone who's anyone, really, not to mention the whole showing world. So it's a fantastic place to come, just to immerse yourself in that world of dogginess and meet lots of doggy people. And for us with Vets Kitchen, it's great to come here and talk to so many people and introduce them to the food and hear lots of good stories about how well their dogs are doing on our food. So we thoroughly enjoy it. It's hard work, but it's some of the best 4 days of the year for us, definitely.
I'm joined now by Filippo, who's come from the specialist service here in Swindon, and he's a specialist dermatologist. So, Filippo, with regards to dermatology, obviously we were saying earlier it's incredibly common to get skin problems in pets. In terms of what we see in general practice and the kind of cases that come to you, how might they be different?
Well, let's say that obviously what you see in first instance in general practice, it could be a kind of a very typical presentation of an itchy dog, which is the most common, or a dog with an ear infection.
Yeah.
Slightly less common presentations, but still things that you can see easily in general practice, is something like a hair loss. What we tend to see in a referral practice is kind of similar in terms of type of conditions. However, most commonly the presentation is much more severe and the clinical signs are more marked. For example, we tend to see cases of chronic skin disease rather than cases of acute skin disease like you do guys in First Opinion.
So going on for kind of years and really driving the people.
Exactly. And one of the most common presentations are those of dogs, for example, with chronic ear diseases that have been going for a while, or dogs where an itchy skin disease, possibly due to an allergy, has been treated for a while without really getting to the core of the problem, and therefore is presented after several years of different treatments at that time.
Yeah. Well, I mean, if these things do go on for a long time, especially kind of ear disease, but it's also skin disease, what kind of things can happen if it goes on and on and on and we don't really get a resolution?
Let's say that one of the most common things that might going to happen in case of, for example, a pruritic skin disease like an allergy, is that after a while you start getting secondary infections, you start getting changes on the skin, and you start getting a lack of response to some of the medications in dogs. In terms of ear diseases, things can get even worse, because from disease of the external part of the ear you can get even middle ear disease with complications that go further and further into even neurological problems.
Yeah, so kind of the head tilt. And
exactly.
Yeah, smash. So in general, I mean, obviously there are all sorts of underlying causes, but in general, what tends to be at the heart of these problems? Is it allergy based? Is it infectious based?
Let's say that every time we face a case, for example, the most common presentation is an itchy dog. Most commonly you'll have to deal with allergies with or without secondary infections. However, it should be really basic to remember that if you have an itchy dog, before you step into the allergy thing, always remember to deal with possible parasitic conditions. For example, scabies is the first one that comes up to my mind.
So mange is what people call it.
Mange, exactly. And which is something that should be addressed initially before obviously you move into the more allergy type. Obviously a presentation with a seasonal pattern, when dogs get itchy, for example, over summer period, might already drive you toward a possible allergic skin disease due to environmental causes.
What are your views on food and allergy and the role it has to play in the management of skin disease too? I mean, food an important thing to consider?
It's a really important. It's a really important part nowadays in veterinary medicine, veterinary dermatology in general. We apply the same concept of medical dermatology, in which we know that the most common form of allergy, called atopic dermatitis or eczema in general, can be triggered either by food or by environmental allergens or by the two of them. Therefore, every time we go into a diagnostic step, trying to find out what are the problem causing the itching, we should always consider to have a look into the dietary related issues. And the suggestions are always to go for what we call dietary trial or food trial, trying specific diet to see if there is any change in the itchy pattern with the change in the diet.
And what kind of stuff in the diet is it that the dogs tend to be responding? Can be anything, but mainly dogs that we see are responding to. Is it?
You mean what kind of food items can trigger an allergy?
Is it? Are we talking? Because there are people out there that go down the raw food diet and say that it's processed foods. There are people that say it's the protein in the diet, it's the rice, it's the
Good question. Yeah, we can say that actually it could be anything. It could be really anything. The principles is that there is not a bad diet in terms of causing allergy and a good diet. Simply, a dog, like people, can be sensitized to a specific type of food item, and therefore no matter if it's a raw diet or if it's a home cooked diet or if it's a prescription diet, if the offending ingredient is there, is going to cause obviously itching. In terms of most commonly food items involved, certainly we can mention chicken, rice, beef derivatives, milk, but it is true that those are ingredients that are anyway as a default present in most of the
Yes.
dog diets. So we don't know if the high incidence of these being involved into triggering these allergic reactions are due to a real problem with these, or simply because they are used more often.
Yeah. And what a lot of people I get here when we talk about possible allergies to things with the food, people say is that, oh, he's always been on that diet, it can't possibly be that. But we do see that they can develop a sensitivity over time.
Absolutely. Again, good lesson from medical dermatology, from medicine in general. We as humans can develop allergies at any point in time. So if it's possible for me to develop milk allergy at a certain age, it's also possible for a dog. And actually, we know through studies that while allergy to things such as pollens or dust mites are things that we see usually in a sort of bracket that goes roughly between 6 months of age and 3 years of age, allergy to food items can develop as early as 3 months or as late as even 15 years of age. So there is quite a big bracket in which you can develop food allergy in this case.
That's really interesting. What kind? I mean, obviously, it depends on what's going on with the dog or the cat in terms of what treatments required. But in general, what kind of tools do we have as dermatologists, as vets, to use for our skin patients?
For skin patients, in terms of allergies.
Yeah.
If we're talking mainly about itchy dogs and allergies, considering that we should always, as I said earlier, rule out scabies, the mange. When we have certainly different medications. What we know is that the approach to the itchy allergic dog should be what we call a multimodal approach. So we have several options. Some of them have high efficacy and a relatively high level of side effect. Other have lower efficacy, but they are much safer. And what we try is to combine the treatment with a different option, trying to stabilize our patient, make them comfortable, and cause less side effect as possible. Unfortunately, it's not always is possible, and sometimes we have to use options that unfortunately can cause different side effects. However, if we're looking in a good quality of life, certainly it's good to have a patient that has a good quality of life, is not really stressed about his itching, rather than have a patient.
So the side effects might be preferable to the itching.
Sometimes this is what happens. In general, what we know is that we tend to use, for example, in terms of side effect, obviously the most common drug that can cause side effect are the steroids. And steroids, we know that they also one of the most effective drugs. So in principle, what we know is that they are a powerful gun. We should use them, but we should try to use them for what we call acute flare. So if we have a dog that is really itchy because of the allergy, then we can use the steroids, we can make the dog better, but then in the long term, we should try to use something that obviously is less likely to cause side effects.
Smashing. Well, on that note, we're going to bring in now Freddie and Mandy, Freddie's owner, who's been receiving treatment for a long time for skin disease, which is pretty common, and we're going to have a chat about some of these issues that's come up, and a chat with Filippo as well. So see you back in a second after this short clip. Thank you for bringing Freddie in. So Freddie's had quite a long-standing skin complaint, is that right? How old is he now?
He's 7.5 now, and
Okay.
he's been suffering for about 2.5, 3 years.
Okay. And when you say suffering, what kind of signs has he been showing?
Constant scratching, itching, he'll bite himself, so he's red raw, and he bleeds, and he's just generally uncomfortable with it.
Oh dear, poor chap. And he's just come to us recently. He's been seeing other vets, and they've done actually really quite a good job. Quite a lot of stuff that they've done there. He's been on different medications, etc. And sometimes it helps, and sometimes it doesn't help.
Well, yeah, the steroids are the only thing that stop him from itching, make the symptoms go away. As soon as you stop the steroids, it all comes back again.
So this would be pretty classic, wouldn't it? That for a skin case, for an allergy case, that they would kind of wax away and they go on a long time. I mean, do you ever? I mean, hopefully, what your ultimate game would be to completely cure the dog. But generally speaking, is it something that's got to be managed rather than fixed?
Let's say that allergic patients can be managed. If you go in with a particular type of medication, well, a particular type of treatment called allergen-specific immunotherapy, you can, in some cases, let's say in brackets, fix
So
your
this would be
patient.
the vaccination?
Is the so-called vaccination. It's based on the principle of testing your patients to see if he develops any specific reaction to allergens that you choose, which could be different types of pollens or dust mites. And once you get a positive result, if you do get a positive result, then there's the option, very appealing option, of making up this immunotherapy, which is basically something that gets injected in smaller amount, increasing slightly over a period of several weeks to months, in a kind of way to try the dog immune system to become more tolerant against things such as external environmental allergens.
And there's a couple of ways, isn't there, that we can figure out what they might be reacting to. So there's a blood test and there's the skin testing, where you inject them into the skin. Is it the skin testing that you guys do at the specialist
The
centre?
skin test is what we guys tend to do as a preferred option. Blood tests, if they're done following the proper modern technologies, are pretty reliable. But let's say that the most reliable option would be actually run the two of them and compare the results. I prefer and I like to run especially the skin tests, because with the skin test you can actually see what happened really in the skin at the moment you do the injections. However, there are options in patients where a skin test cannot be done, and then the allergen serology becomes a valuable tool.
Excellent, excellent. And you say that, so the steroids, you said it really helped, they fixed him, but they're not really appropriate for Freddie. And why is that what you
Because
find?
one, his thirst increased so much he would wee all the time indoors constantly, and his appetite just went through the roof. He just wanted to eat all the time.
But his skin signs would be
Completely
gone.
Yeah.
So again, we were talking earlier about the side effects of steroids, and these will probably be the main ones that people see. And some dogs get much more pronounced signs at exactly the same dose as other dogs. I mean, what kind of things can we do? I mean, can we talk about maybe lowering the dose, or is this where maybe, because you can get oral steroids that people take, which is, I mean, you can also get spray on steroids, and what are your thoughts on those?
Yeah, let's say that the principle is the higher is the dose, obviously the quicker is the action, but you have obviously more side effects. And the short-term side effects are these, mainly drinking more, eating more, but there are other side effects in long term. If the steroids are going to be used as a short-term relief from the itching, provided there are obviously no contraindications, for example, provided we don't have a patient with diabetes, they can be used, and oral glucocorticoid, oral steroids given by mouth are pretty good. When we have to consider the long-term options, or in patients where we really would like to avoid even the short-term side effects, then topical steroids are becoming a really appealing option. There are different forms of topical steroids. In particular, there is a spray that have been put on the market several years ago now, which, used according to the manufacturer recommendations, seems to be free of the typical side effects. And the use of topical steroids in medical dermatology for treatment of people with eczema has long been established as a very good type of treatment. Obviously, there are differences, because treating topically a dog, as you can imagine, is slightly different from treat people topically. But definitely topical steroids are a valuable option in the management of this condition.
Yeah, I was actually reading something recently actually about, because obviously these dogs tend to have flare-ups intermittently, and that actually the use of the topical in the kind of when they're okay can expand out the time until they have a flare-up.
It expands, and in medical dermatology, as I said, there's a few years that to treat flares of eczema, people are started on a kind of a frequent, nearly daily basis, and then once they're under control, they are treated something like a couple of times a week with the topicals, even in periods where they don't seem to have particular issues, just to try to spread the intercurrents of the relapse in their condition. So topical steroids are another option, as well as obviously
and are there any other kind of drugs that kind of work in the same way against allergy that have less side effects that we can use?
There are other drugs. Cyclosporine is certainly one of them. Cyclosporine has been on the market already for several years. In terms of side effect, certainly can cause less dramatic side effect than steroids. Cyclosporine can also cause problems, but they're not as in a kind of way bad as the steroids side effect. And in the long term is certainly a valuable option as well. So basically, if we think of options that we have available for the short term, certainly things such as steroids, either given by mouth or given topically, while in the long term, very valuable options are the allergen-specific immunotherapy, so the immunization, and, for example, the cyclosporin.
Excellent. And now I know that they think perhaps that there's an underlying, or we think there's an allergy going on with Freddie here, and he's been on a diet trial, is that right?
He has.
And how did you find that
Made
worked
no
for him?
difference to him whatsoever.
And in terms of when his allergy is it all year round? Is it so it's not just...
It started in the February
seasonal.
of one year, and they said it was seasonal to start with, and they even tried us on like Piriton, hay fever tablets.
Yes.
Didn't really do anything.
Sure.
And it's just got
It's just
worse.
kind of stayed from then
and
on.
it's always there now.
Yeah. So generally speaking, allergies to things out in the environment, our pollens and grasses and stuff, tend to be seasonal, but and the year-round ones tend to be perhaps things that might be in the diet. But other things like house dust mites, etc., would they be year-round rather than?
Yes. The typical pattern is house dust mite is a all year round, dust and pollens is more seasonal, and a very typical pattern of presentation is dogs that are starting with a seasonal problem, and then over a period of time they becoming permanently itchy, because obviously they can develop with time sensitizations to different allergens, for example to indoor allergens that tend to be in a kind of way stable all year round.
So if you're sensitive to something, you're more likely to go on and become sensitive to something else.
It can happen, exactly, yes.
Yeah, interesting. Now with a diet trial, I mean, it tends to be quite, how do you decide what food you're going to put your animal on?
Yeah, I think it's basically based on having a chat with our clients, with the owners, because obviously at the end of the day we need to do the best for our patients, but we need to address obviously problems and wishes of the owners. So what we tend to do is we offer a list, kind of 2 to 3 options. We offer to go for a veterinary prescription hydrolyzed diet,
Sure.
where
Hydrolyzed means?
Hydrolyzed means that the proteins included in the food are chemically divided into so tiny fragments that the immune system won't really recognize them, and therefore you won't have an adverse reaction to them. Another option is to go still for a veterinary or a normal commercial diet based on simple ingredients, and normally we try to go for something that we know is less likely to cause an allergic reaction. Options are available in terms of, for example, there are venison, different types of meat, or there are dog food based on fish and potato, for example. That is an option. Or, depending from the countries, for example, outside of the UK, one of the options that is most commonly accepted is to do a home cooked diet based on exotic ingredient, something that have not been fed before to our patients, and therefore less likely they can trigger an adverse reaction. And we go from simple things such as pork and potato, if pork is not usually present in dog meat, in dog food, but we go for also the most exotic things, such as, again, we can go into venison or crocodile.
Wow.
Or other type of meat. Yeah, it's quite a typical.
And how long would you tend to do that for?
We recognize that a period that goes roughly between 6 and 12 weeks is the standard period.
And when would you expect to see an improvement in that time?
We recognize that you should expect an improvement from week number 3, so after 2 weeks, and then sometimes it can happen right at the end.
Right at the end.
Yeah, and obviously it's very important. The principle of a dietary trial is to do your diet, but at the end of the trial period, if you have seen an improvement, we should always do the food re-challenge. So we should feed again on the previous diet to see if actually you can see a difference, because obviously an improvement during a dietary trial can also be coincidental.
Excellent. Well, thank you very much, and there's some stuff there for us and Freddie to have a think about afterwards and maybe come up with a plan. And we're going to be joined now by Ed again, and we'll just go quickly through some of the questions, and that'll be that. Thank you very much.
Thanks.
We're back and being joined by Ed again. I mean, that was really interesting. I could have chatted for ages to Filippo. I mean, skin is actually really interesting, and I thoroughly enjoyed that. I hope you did too. So just briefly, we're going to quickly go through some questions. Fortunately, we haven't had too many questions in this week, so we'll be quick. So the first one from Derek Evans is, has anybody ever had a dog with insomnia?
Certainly, I think given the amount of agility my dogs do, they don't get the chance to ever not be tired.
So this is something that could be, right? It could be that they haven't exercised enough, but I suspect that's not the case here.
Equally, certain foods are known to cause higher levels of kind of excitability and things like that. And if you've got a dog that's eating something with a lot of additives in it just before it's settling down for the night, that could be disturbing its sleep. It's certainly something that's perfectly kind of possible. You're going to get a lot of behavioural issues. You're going to get some dogs that, for behavioural reasons or whatever, don't sleep as well as the owners would like them to at the times the owners would like them to. But
there could be something going wrong as well, couldn't it? I mean, things like arthritis, if you've got pain, if you've got kidney issues and you need to go to the toilet, if you're going senile, these things can all present as insomnia.
It would be really useful in this case to know a little bit more about how old the animal is and what its kind of lifestyle is like.
Yeah, I think really that probably these things should go and see a veterinary surgeon, just to make sure there isn't a problem underlying it.
Yeah, it's certainly not going to be a bad idea to have a chat about it with your vet, because it could be something that you could kind of laugh off, but it's probably making a difference to the quality of life the animal's getting and also to the quality of life the owner's getting.
Yeah, absolutely. I mean, I've just been slid in a little sneaky question from the sideline, which comes from Laura Howells, and it says, my cat's got raised bumps around her nipple. They look like crystals. She's been spayed, not sure what that could be. I mean, it's difficult to say. I mean, is it just one nipple or is it a couple of nipples that have been affected? Any thoughts on that one?
Again, I'd kind of like to know the age of the animal. Nasty tumours of mammary glands are really, really, really rare in cats.
They are.
I would hope that it wasn't some kind of mammary tumour, but
it tends to present, doesn't it, as that the whole gland, the whole side, the chain goes kind of big, red and inflamed, and they all get affected at once. So hopefully that's not what's going on.
It'd be if you're listening, Laura, if you can get some photos and email them over to us.
I think if you can get some pictures of the nipples, obviously if she's unwell, then take her to a vet before next week's show. But if she's okay in herself, and it's just some little lumps, take some pictures, send them along to us, and we'll get them up on the show next week and have a little bit more of a chat about them. Yep.
Sounds
so
good.
The final question, also skin related, is from Amy Skilton, who says, our golden retriever keeps shaking his head. Our vet has looked in his ears but he couldn't see anything. We trimmed the hair in case it was tickling, but he still does it. Any suggestions? We gave him a good clean a few weeks ago with a bit of olive oil, which seemed to help. I mean, the fact that putting something in the ear seemed to help would imply that there probably is something going on.
Yeah, and certainly we can fairly easily see things like grass seeds or see that there's a lot of wax or that there are air mites or things like that.
That's the kind of thing that perhaps the vet that looked in the ears would have seen if he was looking.
But equally, there's going to be some things that are so small that we can't physically see them, and yet if the dog feels that they're irritating the ears, what the dog thinks about it is probably more important than what we think about it. Personally, olive oil wouldn't be my recommended choice of ear cleaner.
A lot of people do that though. I mean, it's not number one, no, but a lot of people, and there are worse things you could put in the ear.
There's an awful lot worse that you could put in the ear, but one of the things that we do certainly see, not infrequently, we will see dogs with ear problems where actually the amount of stuff that's being put in the ear is exacerbating the problem. Yes. So I'd probably go back to the vet, have another chat, and
maybe think about something we would always do with an ear is do cytology. So that's basically taking a little sample from the ear and having a look in-house, not sending it away, in-house down the microscope, and to check there isn't a low level of bacteria causing a problem or yeast causing a problem, which you may not see externally.
Yeah.
Good. Anything further to add on that?
Well, just hopefully the dog will feel more comfortable.
Absolutely. So quickly, have you got some captions you'd like to read out?
We've got a lot of captions here.
Pick a few good ones and a winner, please.
Okay. Well, probably one of the more entertaining ones was someone suggesting that it reminds them of the 80s band Spaniel Ballet.
Nice. Good pun words.
We've got a few based around the idea of not wanting the other dog to move because they need a soft landing. One that I quite like, that's I'm a Springer, I can't help it. You'd be amazed how many people get Springers and things like that and then are surprised that they're lively dogs. But the one that I was going to pick as my winner, nice, short, to the point. Just look out, incoming spaniel by Samantha Hurley.
Well, congratulations, Samantha Hurley. If you get in touch with us after the show, we'll send you an email and we can wing to you your bag of Vet's Kitchen food, which hopefully your dog or cat will enjoy. So, just a quick plug at the end here is that this is our renal month now. So we had heart month last month. This is now renal month, and we're doing free screening tests of your pet's urine. All you need to do is bring a little bit of a sample from your dog or your cat. You can either bring that in a little pot, or you can come in and collect a pot from us. We only need about 1 ml, and we can test for things like protein in the urine, the concentration of the urine, which can be really helpful at picking up diseases early.
And with kidney disease, lots of animals won't show any signs until the disease is quite advanced, because you can cope with just having half of one kidney functioning, and therefore you can have kind of 75% of your kidney completely knackered before you start showing signs. So doing doing urine tests to pick up things like the protein in the urine, concentration of the urine, things like that can really be helpful at getting a prompt diagnosis and intervention before it's too late.
Yes, excellent. It's free, so do it. So finally, next week on Vets Clinic, obviously Joe will be back, unfortunately, and it'll be Joe and myself. So I'll be answering your questions again with Joe, and we'll have another live competition. We've got the Pets with Props winner being announced next week, which you can get your free portraits. And I'm really pleased to announce, I don't know if people watch Crufts, but obviously the Friends for Life winner, so Harchie and Owen, really touching story. They will be joining us here live on the couch next week, along with his parents. So that should be absolutely fantastic. So join us then next week, and we'll see you then. So it's bye from me.
And bye from me, and well done, Anthony, for your win at Crufts. One of the agility winners was a local Swindon lad.
Oh, so well done,
Anthony.
Bye now.